guys, this is Preeti and you are watching Medro Solution. In this video, I'll be teaching you about the caseous necrosis. What is this? Caseous means cheese-like appearance. Cheese-like appearance. Necrosis is a cell death. One of the type of the cell death is necrosis and apoptosis. Necrosis, which involves inflammation also. The features of caseous necrosis, it means it includes coagulative as well as liquefied necrosis. You can see it. The first I'll show you through the image. Afterwards, I'll explain through the points so that it will be easy. Caseous necrosis. See this caseous necrosis is the characteristic features of TB, the tuberculosis. In tuberculosis, you see caseous necrosis. So this is a lung image where you can see the tuberculosis cavity. There will be extensive yellow color, yellow and white, cheesy-like appearance, cheesy-like necrotic area. This is a caseous necrosis. Grossly you can see like this. Whereas microscopically you see the caseous necrosis area surrounding Langerhans cells. No R is there in this. Langerhans gained cells. After that, these are epithelioid cells, and after that these are lymphocytes. Lymphocytes, you can see the nucleus is entirely filled. There is no eosinophil, entirely basophilic. This is a lymphocyte, and the last cells which are surrounding this. This caseous necrosis is a fibroblast. This forms a granuloma. This is a caseous necrosis, epithelioid cells, Langerhans cells, this lymphocytes and the fibroblasts. These are the two images of the caseous necrosis. Now we will discuss the points regarding this. That is, caseous necrosis is I already told, characteristic features of TB, the tuberculosis. It is a fourth type of hypersensitive reaction. You know there are four types of hypersensitive reactions. This is a fourth type of hypersensitive reaction. The organ which is affected is a TB involves all the organs. Which organs will be affected by the caseous necrosis? That is, wherever there is a TB, there will be caseous necrosis. So TB infects any organ, especially it infects the lung and the lymph node. LL, you can remember, lung and then lymph node are mainly affected. The appearance I already said, white to yellow color. There will be soft and febrile, granular. It will be similarly looking like a cheese. So the name caseous necrosis. Caseous necrosis means cheese-like, not the cheese-like appearance. You can see yellow color, white cheesy-like areas. You can see on the lung, this is a caseous necrosis. These are the gross features. Microscopic features, you can see granuloma in a TB, in the caseous necrosis. It may be seisating or non-seisating. So soft granuloma or hard non-seisating means hard granuloma. The caseous necrosis is where you can see this pink color thing. In exactly center, you can see this pink color area. This is a caseous necrotic area. Here the lysed or dead cells will be there. Dead cells, but whereas if you see in a coagulative necrosis, there will be architecture is maintained. That is, outline is maintained. But here in caseous necrosis, there is no outline maintained. You cannot make out any this outline of the cells. So this is a caseous necrosis. Caseous necrosis, there won't be any outline. Cell outline won't be there. Whereas in coagulative necrosis, you can see outline, but it appears eosinophilically closely granular material center. You can see eosinophilic material. You can see, and the surrounding cells also showed epithelioid cells, Langerhans cells, then lymphocytes, then fibroblasts. All this forms a granuloma. Langerhans cells type gain cells. In this, nucleus will be arranged as a horseshoe shape of like this horseshoe shaped. Nucleus will be arranged. If caseous necrosis undergoes further, this is necrosis is also cell death. No, after that is after cell death it undergoes calcification, dystrophic calcification, because it occurs in a dead cells. If necrosis means necrotic cell means it is already dead. No, so in case of caseous necrosis, dystrophic calcification will occur. That is the calcification that occurs in the dead tissues. This is all about the caseous necrosis, causes or gross appearance, then microscopic features and the cells which you see in the caseous necrosis, and it further leads to the dystrophic calcification. This is a diagram which you have to write. This is a caseous necrotic part. This is a caseous necrotic part. This thing, caseous necrotic part, you have to show the eosinophilic pink eosinophilic thing where the cell architecture is already lost, and then this is our epithelioid cells. This is Langerhans gained cell, and then these are lymphocytes, and the surrounding lymphocyte there will be fibroblasts. This is the microscopic appearance of caseous necrosis. That's all for this video. This is important for 5-mark question. You need to write everything so that you gain more marks. If you find this video helpful, please do like, share and subscribe to my channel. Thank you.